There can be no healthcare without the people to deliver it. Health workers are the backbone of any health system and play a crucial role in saving lives. Here is a story of how timely support from health workers helped a woman to overcome cancer.
എൻ്റെ പേര് സിന്ധു. ഞാൻ ആശാ വർക്കറായി ജോലി ചെയ്യുന്നു. സുനിത ഈ അസുഖം കണ്ടുപിടിക്കുന്നതിന് മുന്നേ
Sunita would walk past my house every day on her way to work at the cashew factory. This was before she became ill. She often complained of pain and also visited several doctors. The community health center referred her to the district hospital for scanning. The doctors there even gave her the money to undergo the test when they learned she could not afford it. She knew she had cancer. When I met her, she was most worried about her 65-year-old mother, who would be left with no support if something were to happen to her. I went and spoke to Mr. Gopakumar, the health inspector at the primary health center, about Sunita's condition. He came along with me to see her, and it was this meeting that changed her life. I see her going to the market and I cannot express the joy I experience.
When I first saw Sunita, she lay shivering on the floor with high fever. The neighbors who had gathered around her thought she would not even survive for the next 5 to 10 days. I was deeply moved at the sight of Sunita and her aged mother taking care of her. I felt that if I failed to support this family at this juncture, there was no point in calling myself a health worker. The treatment was expensive and the family had no resources. We raised 63,000 rupees by requesting people in the neighborhood to give up fish for a day and contribute that amount towards Sunita's treatment. Learning about her condition through the media, many others also came forward to help and donated over rupees 2 lakh. Today, things are looking up for Sunita. She has recovered enough in the past 2 years to be able to return to her everyday life.
സുനിതയുടെ ലെസൺ, അതായത് സുനിതയുടെ ഈ പാഠം എനിക്ക് മനസ്സിലാക്കി തന്നൊരു കാര്യം.
Sunita's story brought one lesson home to me. No matter how poor or sick a patient is, if we are able to provide complete care, including mental and financial support, we will be able to help them recover. The possibility of leading a near normal life once again, to me, is the moral of Sunita's story. Health, as defined by the World Health Organization, includes physical, mental and social well-being. Therefore, we need to look at providing more than just medicines to the people who come to us for treatment.
While frontline workers, doctors and nurses make a difference in people's lives, they are not the only health workers in the system. There are many people who work behind the scenes to deliver care, and many more who orchestrate this symphony. The challenges faced by health workers vary widely across India, but some common ones include overcrowding, limited supply of equipment and drugs, and limited opportunities for knowledge and skill development. Some of the challenges are overcome by health workers who believe that systemic change is possible. For instance, one woman's vision to improve quality of care in government facilities led to the General Hospital in Ernakulam to become one of the first NABH accredited government hospitals in India.
I am Dr. P.K. Jamila, Kerala Samsthana Arogya Vavupu Director.
A few years ago, NABH accreditation for hospitals in Kerala was only a dream. It was at a training program that I first learned about it, and I decided to get this accreditation for some hospitals in Kerala. When we started the process, a few co-workers were apprehensive about a government hospital getting NABH accreditation. However, we went ahead with our plans and identified a few Zilla hospitals which had the potential of getting the accreditation. We selected the largest 4 Zilla hospitals based on the staff and leadership at the facilities. It was under the leadership of Dr. Junaid Rahman, the then Superintendent of Ernakulam General Hospital, that Ernakulam General Hospital became the first government general hospital in India to become NABH accredited. The general belief is that the best treatment is available only in private hospitals, but this is not true. The staff at government hospitals is more qualified, knowledgeable, and experienced. But for many other reasons, they are unable to perform to their capacity, and that is what requires more thought. Almost 48,000 people work under the health department, and this, you will agree, is a lot of people. But to develop and strengthen them is the need of the hour. There is an urgent need to provide them with better training, facilities, and also look after their requirements.
The need of the hour is to strengthen our health workforce. Tapping the potential of our health workers is essential for better health for all. Let's strengthen people for health so that we can have health for people.